Hello and welcome to another episode of Face to Face. My name is Godfred Akoto Boafo. Now we live in the time of COVID now. The world will never be the same after the coronavirus. Several lives have been upended and changed in several ways. And on Face to Face today, we are going to try and understand from a continental perspective how lives indeed have changed. And to help me do that is an academic who is an expert in her field. She is the Director of African Center for Migration and Society at Wits University in South Africa. Professor J.O Veary is our guest on Face to Face. Welcome back to Face to Face, and I must say a big welcome to Professor J.O Veary all the way from Johannesburg in South Africa. Hello, Professor Veary.
Hi.
Pleasure that you're joining us on Face to Face. How are things in South Africa?
We are in the third week of what was originally a 21-day lockdown, which has now been extended until the end of April. In South Africa, our lockdown is quite strict. We are only allowed to venture out for essential food items or to go to the pharmacy or to a doctor's surgery, for example. So we're not allowed out for exercise, for walking or anything like that. Which obviously for those of us who are fortunate to be living in a house that is a freestanding building, that is something that we're able to do, work from home for some of us. But we know that for many in South Africa, that reality is far away. And so for many, this is a particularly difficult time.
And that situation you describe, one can say is a reality for a lot of Africans as well. And for you in the space of mobility and migration, how has the coronavirus upended the norms that you're used to?
So, I think there's two key issues here. The first is that we know that South Africa, but also other countries on the continent, experience high levels of movement within countries, so of citizens who are moving, either between different provinces or different regions, but also within, for example, urban areas, between peripheral and central urban spaces, for accessing work, for example. So at the moment, we know that the different forms of lockdown across the continent have disrupted that. So for many, this means that there are difficulties in accessing places of work, for example, if those were places that perhaps would still be functioning during lockdown. But it's also meant that people who perhaps would more regularly move between areas where they're working or searching for work and areas that they would consider their main home has also been disrupted. So we need to think about what internal mobility means in terms of our responses to COVID-19. But also we need to think about what it means for foreign nationals within different African countries. South Africa, we know, is home to the largest number of migrants from the SADC region, as well as migrants from elsewhere on the continent and further afield. And we see that once again, we've seen this in many different responses within health systems responses. For example, foreign nationals are really being left behind and left out of the equation. We're not seeing consideration of the needs of those who are non-citizens really being considered in our systems responses. Ironically, what we've seen is those who are the more wealthy tourists who had traveled to South Africa, particularly from Europe and North America, at the time when the first cases of COVID-19 were imported into the country, special measures were put in place for those individuals. For example, their visas were extended and they were given an extended right to remain, to retain a legal status. They were given the option to remain in the country should they prefer to do so rather than return to their country of origin. However, for individuals from within the region, that same opportunity was not afforded. So we see a situation where we have foreign nationals who are struggling with documentation, for example. They're unable to access documents during this time. Asylum seekers in particular, the refugee reception offices, where individuals are required when they're seeking asylum to renew their permits between every 1, 3 or 6 months. These offices are currently closed. There's been assurance from the Department of Home Affairs that individuals won't be penalized for that, but they've been told that they must access those extensions within 30 months after the end of the lockdown. How that will happen, given the increased pressure that will place on the systems, we're not sure. And finally, we haven't heard anything linked to the ways in which your legal status in the country, the documentation status you may hold, your nationality, is being considered within the very ambitious community-based screening and testing campaign that South Africa's embarked on. And there are concerns that without engaging on that, foreign migrants may be fearful of accessing services or being part of those responses, given previous experiences that have perhaps been very negative with the engagement with the state, but also healthcare providers themselves. We're concerned that they haven't been given up-to-date information about the importance of ensuring that everyone in the country is included in the screening testing campaign.
Now, Professor Veary, you talk about two things here, and I'm very interested in the first part, the part on internal mobility, because considering the response of a lot of African states, we've seen some in full lockdown, like you say, in South Africa. We've seen some in a partial kind of lockdown. We've seen some with curfews in place. We've seen all kinds of measures put in place, and all these measures affect mobility, internal mobility, that is. First of all, is there a proper way, one would say, of doing this? Could countries have had a blueprint to follow for this, or countries have had to make this up as they go?
I think that it's an incredibly difficult situation. We know that for communicable disease control in the context of COVID-19, where we have got this unprecedented pandemic, where we know the virus spreads very quickly, and we know that it can spread in ways that are not noticeable, as in individuals may be infectious but not displaying any symptoms. So there was an important need to lock down, as we may use that language, to prevent people moving in order to try and develop some form of control of the initial outbreak. But there are challenges within that, because one always has to balance sort of best practice in terms of communicable disease control with broader public health principles. We know that if people are not able to be in a safe space, if people aren't able to be with, for example, family, if people aren't able to work or they lose their jobs because of the lockdown, that may affect where they're able to stay. It might be impacting, for example, on their ability to pay rent. It might be impacting on their ability to access food and shelter. So difficult decisions were made, but I do think that we didn't know, and I'm not certain that we still know what the best practice is around this. We are learning, as you say, by doing. I think that we're recognizing where mistakes are made, but there are big concerns around the ways in which some of this is being governed. So, for example, we know that in Cape Town, we know that there are concerns around the ways that the COVID-19 response is being used to give the state the ability to evict individuals who are currently living in informal areas, for example, under the guise of saying that this is about moving people to safer areas. Many of these individuals are South African migrants who have come from another province, who are in the city searching for work or working. Sorry. And we know that there has been incidences of quite extensive police violence, also including the army, in the ways that the city is now carrying out these illegal evictions, even though there has been clarity from the state that no evictions should take place during the period of lockdown. So we're also seeing internal migrants, who tend to be those on the periphery, who tend to be the most disenfranchised, are being further negatively impacted through this process.
But that's also, you talk about learning as we go. Now, a lot of African countries, and Ghana was one of those countries, had to weigh the balance between locking down and economic survival for people. And most of these people were in the informal sector, and most of these people were internal migrants. These are people who would move internally in the course of the normal day to be able to survive. Now, in putting out these orders, there were those who said, okay, do we lock down immediately, or do we give room for some of these people that you mentioned who are in vulnerable positions to be able to find some sort of respite before we do that? What has been your observation of these strategies post their implementation? I'm sure you've had time to observe the different ones across the continent.
I think it's incredibly difficult. I think that people have had to make really difficult decisions between, as I mentioned earlier, what is an effective communicable disease control strategy versus what it means for individual freedoms and individual socioeconomic security. I think in some cases that we have not considered these difficulties sufficiently, but it's taking too long to figure out how best to support those who are the most affected through this. I think initiatives that are coming into play that are trying to support people are too late. So, for example, recognizing that food security is a huge issue, and we are seeing, lots of community unrest. And for example, when food parcels are collected and are to be distributed within a community, perhaps there are some rioting, people trying to access those food parcels, people, looting shops, for example. And I don't think that system was put into place in a way that is either respectful or particularly effective. But in terms of what should be being done, I think that's hard. That is hard to say. And I think that there have been many debates in South Africa, as there have been elsewhere on the continent, with a lot of conflicting thoughts around what is best. But I do think nobody wants lockdown to remain. Everybody knows that lockdown is an emergency measure, which is something that has to be short-term. How short-term is the question? We know that if you remove lockdown too quickly, then the benefits of slowing down the spread of the virus could easily and very quickly be undone. And then you're back to a far more, you've not gained anything through the lockdown. The other challenge is that we know these communities that are also the most vulnerable to the impact of the lockdown are also spaces where, if and when COVID-19 enters these communities, due to the fact that these tend to be very densely populated spaces where access to clean water, for example, is not guaranteed, where individuals will have challenges in practicing the safe hygiene measures that we know are required to help reduce the spread of COVID-19, of coronavirus. We know that these are the same spaces that are most affected by the impact of the lockdown. So we end up with a kind of double negative effect, where these communities that in the way are the most vulnerable and are recognized as that and need to have the most support, actually through the lockdown measures themselves, are actually facing far more challenges than others in the country.
Now, you talk about vulnerable populations. First of all, can you help us understand who are those we consider a vulnerable populace? Because I guess in a state making a decision to support certain people, it must find ways of placing such persons within a certain category. Can you just help us a bit with that? Who are those we consider persons who fall into the vulnerable population category?
So in my mind, there are two key kinds of ways we need to look at this. And bearing in mind that I'm not an infectious disease specialist, my background is in public health, but I'm not the infectious disease specialist. But we know in terms of coronavirus and the resulting disease, COVID-19, we know that there are particular categories of people who are more vulnerable. By that, what I mean is that should they become infected with coronavirus, they're more likely to have a bad outcome. They're either more likely to get more sick than other people, they might need to be hospitalized, and unfortunately, some of them may be at risk of death. These are individuals who tend to be older. That tends to be the case, although there is different evidence emerging from elsewhere in the world, but not necessarily yet within the African continent. The other is around issues of pre-existing conditions. So there's been concerns raised about people, for example, who might have diabetes or might have asthma or pre-existing lung conditions, and individuals who are currently immunosuppressed. So their immune system is not functioning as well as somebody else. In the context of the continent, we know that this would potentially apply to individuals who, for example, have tuberculosis or have previous history of tuberculosis, individuals who are living with HIV who are not currently on treatment. What appears to be the case is that individuals who are living with HIV and are on treatment and whose viral load is undetectable appear to be affected no differently to any other member of the population. But we know that we do have many individuals in South Africa and beyond who are living with HIV and either don't know their status or do know their status but aren't currently on treatment. And it's imperative that those individuals are supported to access treatment as soon as possible. So in some ways, this is the language of vulnerability, right? So vulnerability to the impact of acquiring if one is infected with coronavirus. But the language of vulnerability, in my mind, is far broader than that. It means we need to be looking very carefully, and this is recognized in the majority of the health responses we're seeing, and particularly in South Africa, it's acknowledged how to respond is the bigger question. But people living in densely populated environments, as I mentioned, informal settlements, people who are residing, for example, in inner city spaces where we have many people sharing flats, for example, where you have maybe 10 people in a 2-bedroom flat who are sharing that space, where you have people who are struggling to access water, for example, but also other individuals who are often found to be living in these spaces, who might be working or have previously worked in either informal sector or in currently criminalized work. So, for example, we know that the sex worker community in South Africa is currently struggling greatly under the current lockdown. They're not able to work, but because their work is criminalized, they're also not recognized by the state and not necessarily by the rest of civil society in some cases as being people in need.
Now, Professor Veary, just to stop you there, that seems to be a running theme. I'm happy you brought up the issue of sex workers, for instance, because in Ghana we've had a similar case. Again, it is illegal, where we've had authority come out and say, if we find you working, we will arrest you. Mm-hmm. And they are not placed under the vulnerable persons line. How does society mitigate that line between persons like sex workers who in this time, like you're saying, really cannot work and have no other forms of earning an income?
I mean, in the first instance, I would say that this is no different to what we see day to day. We see day to day that there are particular communities within South Africa, within other contexts, you've just spoken about Ghana, and sex workers are one such community that tend to be left behind in health and social system responses. They're left behind because they are stigmatized, because their work is criminalized. We know that these are people who tend to then struggle to access healthcare services at the best of times. So the minute that we then see the response to, for example, what we're seeing now around the response to coronavirus, these groups are even more stigmatized. They're even more left behind, as it were, because we know that there are many groups who are struggling and the system's responses aren't reaching those individuals. So at the moment, it's really down to civil society to be developing responses to support sex workers. And we know in South Africa that we do have a strong sex work civil society movement. However, it's not enough. And these are individuals who need to be being supported the same as others. We know that there would be other issues often in that community linked to, for example, drug dependency, and all those kinds of support systems are also now fully disrupted. So not only are people not able to work, they're also not able to access the support that they require. If they're living informally or they're living on the street, for example, they're going to be even more at risk in terms of the way that the police, and in the South African case, the military, are patrolling, are policing the streets at the moment.
Is there a learning on resentment, for instance? I read an interesting article, and I think it was written by a South African academic, who said that the coronavirus lockdown seemed to have become a lockdown of the formal economy as opposed to the informal economy. And so you find persons in certain categories of society beginning to resent the fact that they're home, can't work, or perhaps still have the ability to work from home, but are limited in their mobility, as compared to persons we will label as being in the vulnerable category and also being in the informal sector category, perhaps openly moving around, and in some cases, some would say, flouting lockdown regulations. Have you had a sense of that as well?
I think that unfortunately, particularly in South Africa, we live in a society that remains segregated in terms of not only race, but also in terms of class and socioeconomic status. And unfortunately, there is a tendency of those who I would argue, are the most able to practice the lockdown rules, who are the most able to stay at home, who are the most able to work from home, who often have the greatest safety nets, who can be in a safe space, which we know isn't the case for everyone. But for that group, we really have, and I'm part of that population, and we have a huge responsibility because we can physically distance. We must be physically distancing. Individuals who are reliant on the informal economy and are working within informal spaces, those are individuals who are the least able to practice physical distancing, either due to the spaces that they live in, due to the ways in which they travel to and from the spaces where they're working, or simply due to the fact that they are, like many individuals in these situations, struggling to access, for example, food. So we see that there has been permission for informal traders who are given a permit by their local municipality to continue trading. This is incredibly important for a food security perspective. These are individuals who ultimately are, through informal traders and through spaza shops, small shops in peripheral spaces in particular, they are providing food for individuals living in those spaces. If we shut down spaza shops and we shut down informal traders, then not only do those individuals lose their livelihood, the population surrounding them lose access to food. Unfortunately, part of South African society doesn't seem to understand that. So people perceive this form of work as somehow flouting rules and regulations. They see individuals who are moving and are on the street in the daytime and they perceive them as flouting regulations. But these are individuals where you've got 5 people sharing a single room, you cannot physically distance and you cannot stay at home all day. And so these are the tensions and the challenges. And personally, I think that there are many in South Africa who need to be doing a lot more careful thinking around what they perceive to be flouting the rules and recognizing the privilege that they're sitting with, given that they can be at home, sat on the internet, etc.
You are watching Face to Face, and we are speaking with Professor J.O Veary, who is the director of the African Center for Migration and Society at Wits University, discussing situations that I'm sure most of you are finding very, very similar, wherever it is you may be that you are watching us from. Face to Face, we'll be right back. Welcome back to Face with Professor J.O Veary. We are discussing mobility and migration, two very important aspects of the coronavirus pandemic, especially on the African continent. And my guest is all the way in Johannesburg in South Africa, but we are having a very continental conversation. So, Professor Veary, we've spoken about the internal mobility. Now, we've also had pro-poor policies. Again, we've seen a lot of countries come up. I've seen stories in Guinea where the government says they're paying electricity bills, they're going to give money. In Ghana, for instance, the government is absorbing cost of water and electricity for citizens just to serve as basically a buffer for persons who we would consider as being vulnerable. What do you make of some of these pro-poor policies?
I think the recognition, I think states recognize that the lockdown is having particular impacts on particular groups. And no one's had experience of this kind of a scenario before. I think that states are, in many cases, trying to see how they can best support those who are going to be suffering the most. However, we know that many of the support systems that have been put in place will only apply to a small proportion of that population. So, for example, in the case of where the state maybe is covering electricity costs, that's not going to help people who don't currently have access to electricity, for example. Where people might be supporting, in South Africa, we've seen, we do have a grant system in South Africa, and there have been calls for increasing, for example, the child support grant. to increase it slightly to try and provide a bigger buffer for households that are negatively affected. We haven't seen that come into play. But we have seen, for example, systems being put in to try and support small businesses who are going to be negatively affected. But again, the regulations around that and who qualifies is going to leave behind the most vulnerable within those spaces. So I think that we collectively across the continent, and I would say more widely globally, are struggling to find ways that the state can meet those needs. But it's also raising important questions and real concerns around the ways in which this is highlighting those inequities that exist in the day-to-day normally. It's highlighting to, I think, many how disparate the differences in sort of economic stability and so forth that different individuals have. So I don't think any single country has got it right. I think that we need to recognize challenges with fiscus, with the monies available, with ability to distribute those funds, decisions that need to be made around their distribution and how. So a real headache for countries. I think we're going to be seeing a lot in the next few months, the next year, to be able to look back and see what worked, what didn't work, and look to improve contingency planning processes.
Now, continent-wide, I think one category of persons that rarely gets spoken about are refugees, and this is a continent with a lot of refugees. What have you made of how coronavirus has affected refugees and countries that harbor refugees are handling this particular matter?
So I think it's important, as you say, to recognize that the continent is home to many refugees. And this is something that's often not recognized at a global level. Even though countries on the continent are hosting these communities, we know that when we look at a global response to the refugee community, often lower and lower middle income countries that are hosting refugees are often left out of the conversation. So I just wanted to flag that. We then have a situation where we have some refugees in different African countries are residing in refugee camps, refugee settlements, and in other contexts are living within the national community, often in urban areas and urban refugee policy. I am concerned, as many others are working in the sector, at the ways that these communities and populations have been left behind in the response by states. I think there has been a lot of activity on the behalf of civil society and international organizations to explore what needs to be done and to try and support interventions, particularly from refugee-led interventions and refugee-led organizations themselves. However, without the support from states, these are going to struggle. We know that refugee settlements, refugee camps are highly populated, tend to be very densely populated, and are spaces where once you have coronavirus entering, it is going to spread very quickly due to the fact people cannot physically distance. So it helps nobly, particularly individuals living in those spaces, but also the wider community, the country as a whole, different regions of the continent, if these communities are being left out of our responses. There is some effective organizing, as I mentioned, happening around this. I know that different international agencies are trying and different community groups. But like I say, without the support to do so, these communities are going to continue to be left behind.
We can also then talk now about migrants, and you alluded to that in your opening comments. And the weekend, for instance, saw a lot of African news wires reporting some of the incidents that had happened in China, for instance, where there had been allegations made of Africans being treated or being maltreated or stigmatized in a certain way. How is the coronavirus impacting migrants? If you can elaborate a bit on your initial comments, and then we'll take it from there.
We need to recognize that we live in a world where xenophobia and anti-foreigner sentiments are increasingly prevalent. And this is no different on the continent when we look at the ways that nationals from different African countries are treated within different spaces. I think the examples that we've seen recently around the way that African migrants have been treated in China is unfortunately something that many of us have been expecting to happen. It is not new that when infectious disease outbreaks take place, that foreign nationals are incorrectly blamed. And this has been the case in the way that coronavirus has moved, as I mentioned at the start, that we saw wealthy tourists bringing the infection onto the continent. But other foreign migrant groups are at risk being blamed for further spread. We know that there were, I believe it was 2 Mozambicans that were killed in Malawi a week or so ago. They were assumed to be the local, it was described as being spreaders of coronavirus. And we need to recognize that there is a likelihood that we may see more and more of this violence. In South Africa, we've seen a Ethiopian individual died after being abused by and beaten up by the police. We've seen other forms of violence against foreign-owned shops in different parts of the country. This sort of violence takes place daily in South Africa, unfortunately. But we are seeing it manifest in different ways. We're seeing it manifest in the way, not only in terms of physical direct violence against people, but also the way that policies may be silent on foreign nationals, and what that means in terms of the state's response and whether or not they're engaging with the realities of needing to respond to the needs of foreign migrants. So there are real concerns about the way that foreign nationals may be being singled out and blamed for the spread of coronavirus. But as I mentioned, importantly are the issues of structural xenophobic violence and the exclusion of foreign migrants from the development of state responses.
And it's important that you mentioned the exclusion, because if you read certain agencies, and there's a piece on the World Economic Forum, for instance, that alluded to one danger being a slowdown in state services based on the coronavirus and the impact that could have on migrants, because those who are in the process of applying for visas, and again, you alluded to that initially, those who are looking to be resettled, those who are in detention camps, for instance, no work gets done on this based on the disease.
Yeah, so these are spaces that are being left in limbo. Real concerns, obviously, around detention facilities, in the same way that there are concerns around other prison systems and so forth. You've got individuals who are being crowded into spaces where the minute that we do have coronavirus in those spaces, the opportunity for transmission is very high. But we also need to recognize that these spaces existed before coronavirus and will exist afterwards. So there's an urgent need to respond now, but those responses also need to be more forward and longer term looking, not only emergency responses now. But we do need to think about ensuring that there are embargoes on detention, on deportation regimes. We need to ensure that individuals who struggle to access public services due to perhaps an irregular documentation status, and those who have a regular status and hold the papers required to be in the country legally, but receive poor treatment from frontline healthcare providers, for example. We need to work even harder to make sure those groups can access services at the moment. We need to make sure that individuals feel safe if they are involved in community screening and testing programs, and that individuals feel safe to report contacts for contact tracing. This is incredibly important, and I worry that we haven't thought about this enough. If an individual is fearful themselves, they aren't necessarily going to report some of the contacts that they may have had over the preceding weeks. In South Africa, where we're implementing the use of cell phone histories, working with cell phone companies to document the movement of people, to look and see if we can trace where individuals have been and moving forward as well. This is creating a lot of fear, not only amongst the South African population, but particularly amongst foreign nationals who are concerned that this is going to be shared with the Department of Home Affairs, that it might be used against them in some way. And we really need urgent state intervention to reassure these individuals that that isn't the case, to reassure individuals that they won't be penalized or face negative outcomes for participating in screening and surveillance programs.
There's an interesting article again on migration policy. I'm sure it's a newsletter that you might follow, and basically says that coronavirus is spreading across borders, but it is not a migration problem. And basically the theme of the article is that states are using coronavirus as a tool to pursue a me first policy instead of now being the time to open up. Is that a sound theory for you?
I think we have to be very careful, but it is true that the ways in which nation states can use disease outbreaks as ways to further securitize and close their borders is something we need to be very careful about. We know at the beginning of an outbreak that closing of borders, for example, and some travel restrictions can be helpful in helping contain the virus at the beginning of an outbreak. However, once we have community level transmission, the closure of, for example, borders and ports is not necessarily helpful. What we need to rather be doing is having quality testing, screening processes in place. By closing borders, you are also likely encouraging individuals who may have family one side of the border, who have perhaps concerns around their documentation status. You're pushing them to cross borders in an irregular way, which means that they won't be part of testing or screening or follow-up or contact tracing processes. We need to recognize that is a really important reality, particularly on the African context. And finally, the field of global health security is a very established field. And within that, there are important lessons learned for how to ensure that health diplomacy is working in conjunction with those responsible for managing immigration systems and border management. But unfortunately, there are concerns, and we are seeing this, the way that these border regimes are then co-opting a global health security agenda and the state of an outbreak of a communicable disease to facilitate the implementation of further restrictive processes. We need regional responses, we need continental responses, but the AU or the SADC region, for example, isn't going to be able to develop and implement coordinated responses if we're not talking more openly about what's happening the other side of our international borders.
But do you see a way back from this? Basically, I mean, post-COVID, and this is purely hypothetical, a situation where nations revert back to what the situation was prior to this, or we will see an entrenchment of this nation-first policy now? Because let's be honest, prior to coronavirus's emergence, there were certain states, largely in Europe and other places, that were trying to find means of keeping migrants in all forms out.
Yeah. I mean, unfortunately, I think that we are going to see a public health crisis, a global health crisis, being used to the benefit of supporting these sorts of nationalist agendas. And I think this is something that many involved in the migration health field, involved in global health security are aware of, and there are concerns around this. Because we can't address global pandemics, outbreaks. This isn't going to be the last time we see an outbreak like this. And we need to be more constructive in the way that we think about relationships with neighboring countries. We know that, as I said, this increasingly nationalist, anti-foreigner, anti-migrant agenda that we see globally now is a prime time for nation states to use coronavirus and the current pandemic as a way to further close their borders. This is worrying, and there are big concerns about what this is going to mean in the world after, or the world with coronavirus in the coming months and years.
But on a continental level, though, and I'm talking about inter-African situation, do we see a leveling? Because if you look at the kind of interactions that exist between African countries, I go, for instance, to a country like Gabon, and the informal sector is dominated by persons from Mali and Senegal. These are second, third generation persons who keep on moving in and out, or some from Cameroon as well. On a continental level, do you see this being the situation as well, or you would encourage African governments to talk a bit more?
I mean, I would, of course, encourage different regions, different, neighboring countries who are developing bilateral agreements, for example, to be thinking around, free movement, particularly within different regional economic communities. And we know in some spaces that is more effective than in others. And it's important that the current context isn't either slowing down or preventing where we've had constructive conversations taking place. But we also, in the same vein, need to make sure that in spaces where there are many oppositions to opening borders, and I think SADC is an example there, that the coronavirus, the current outbreak, isn't used to further justify closing of borders. I mean, I think if we look at Ebola in West Africa, it's a good example of where borders were closed, but in constructive ways that were done in order to support disease control. And that was how it remained. It wasn't about furthering nationalist agendas of keeping individuals out. It was much more to do with a public health response. And the concern with coronavirus, it's more widespread. And is that going to further facilitate some of these borders that seem to be growing physically, but definitely in terms of legislation and in terms of the way that foreign nationals are being treated in certain countries? And I'm particularly concerned about what that means for South Africa.
All right, then we'll take our final break. And when we come back, face to face, we'll wrap up with Professor J.O Veary all the way from Johannesburg. Welcome back, and we're in the final hurdle of face-to-face and our conversation on a continental approach towards migration and mobility vis-a-vis the coronavirus, and our guest is Professor J.O Veary. Now, Prof, let's complete the conversation with a series of things. I've seen you express concerns about what you call health inequalities. What do you mean by that, and why is this such a huge concern overall?
So what we need to recognize is that across the continent, we have big differences in health status. So we have unequal distribution of good health within the continent, within countries. And we need to recognize that much of this is linked to historical differences. It's about looking at who's able to access quality healthcare, who's able to access secure livelihoods, to be able to purchase good food, to live in safe and secure housing, for example. And we know that many are not able to. And South Africa is a really good spotlight on this, unfortunately. We know that South Africa is the most unequal country globally, and we know that the levels of extreme health inequality, which results in extreme health inequity, so differences in the distribution of good health that are unfair and are unjust. And these underlying structural realities obviously then are pushed into the spotlight through the current coronavirus pandemic. So we see a complete layering of the communities that are considered the most vulnerable in relation to coronavirus are also the communities that are already experiencing poorer health outcomes. So, for example, people living in informal areas where we know that there are poor health outcomes as a result of not being able to access food, not being able to access safe water, safe shelter, spaces where we know that gender-based violence is much higher, and so forth. These are spaces where individuals are also more at risk of negative outcomes should they be infected with coronavirus. So what we're seeing is a really clear sort of mapping of these inequalities. And I think it's come as a shock to some who aren't involved in working with these issues. And it is a further frustration of many who work in this field who for a long time have been encouraging states and calling out the need for states to better engage around the language of pro-poor policy, but importantly, looking at what we refer to as structural determinants of health. So looking at spaces, why is it that health outcomes are poorer? Why is it that we see higher rates of violence? Why is it that there are higher rates of rape or child malnutrition, for example? Because these are the spaces that are the most vulnerable to health crises, as the one we're seeing at the moment.
Now, in terms of, like, for those of you in academia, for instance, of course, already I'm sure you'll be looking at the migration and mobility space and trying to figure out new lessons. What are those that already stand out for you that perhaps African governments should consider in terms of policy going forward?
Unfortunately, I would argue that, and this is a very depressing reality, I would argue that what we're seeing at the moment is unfortunately what we have been warning states about for a long time. We know that if you don't engage with migration and mobility within your health system responses, you're going to struggle in the development and the implementation of certain health responses. If you're not acknowledging that people move within the continent, within regions, within countries, and find ways to engage with those individuals throughout their migratory process, including people who move regularly in circular ways, we're going to face challenges. We believe that, for example, when we look at HIV, one of the reasons that we have failed to further improve our response is because people move and our responses are not sufficiently migration aware. The responses are not mobility competent. So the responses are not able to deal with these kinds of movements. And unfortunately, I think what we're seeing in the context of coronavirus is these warnings and the existing evidence really coming into play. So I think that it's unfortunate that we need to really be calling out the fact that we're not necessarily seeing something unexpected, which is somehow, I think, far worse than seeing something we didn't expect. And it's not only within the migration sector that we're seeing this, it's also within the wider field of global health and public health, where issues around inequity in health, as we were just discussing, have been high on the agenda, but unfortunately have not been taken on board by member states. So the challenges we're seeing really are a manifestation of what we already know. Coronavirus is obviously going to give us, further insights into some of these things, and there will be, unfortunately, new lessons learned. But I think that the reality, the frustration and the disappointment that many are feeling at the moment is that these are issues that have been raised many, many times for several decades, and the manifestations of these challenges are really coming to the fore now.
That is indeed depressing. I thought you were going to sound a bit more hopeful, Professor Veary.
I mean, I hope I'm proven wrong. I would hope that we'll be proven wrong. I mean, there are, we are also seeing on the behalf particularly of civil society, the development of innovative responses. We are seeing some states trying to implement certain responses that hopefully would address these issues. But unfortunately, we are seeing migrants and the issue of migration and movement once again being left behind.
All right, then. Thank you very, very much for your time today on Face to Face. Professor J.O Veary, she is the Director of African Center for Migration and Society at Wits University, providing some insight for us on the show today on how continent-wide we are handling mobility and migration. It's a part of the coronavirus that we tend to ignore, but it's what is in front of us. For those of you who are in Ghana who pay attention to the news, you see the government coming up with all sorts of measures to try and feed persons. The government is trying to stimulate small businesses. The government is trying to make sure that markets do not close so long as they practice social distancing protocols. These are the things that are important to the day-to-day part of the coronavirus conversation. That is what I've been trying to explore with my guest today. I hope you enjoyed it. My name is Godfred Akoto Boafo. Have a good day.